News. You're here with me, Marilyn Gore, and we are on the Wellness Benefit podcast. Today we have with us Dr. Jimit Sanghvi. He's an ophthalmologist based in Ahmedabad, and we'll be talking about the effects of diabetes on eye health. Thank you for joining us, Doctor.
Thank you, Marlene.
Let's dive right into this. Okay, we've heard that diabetes may you have problems with your eyes. Can you tell us a little bit about that?
Marlene, diabetes is basically the disease of vessels, blood vessels.
Mm-hmm.
So, as you know, there is vessels in all our body. So, there is vessels in retina of the eyes. They supply the main core. Retina is the heart elixir of the eye to see the picture.
That is where light जो गिरता है
Yes.
हाँ जी, okay.
So, you have to maintain the retinal anatomy and its physiology normally. So when you have a diabetes, there is a chance there is a blockage of that vessels, and that vessels will hamper the all your system of eyes. So diabetes is actually affects a lot of things in your eyes. So you have to be careful for diabetes.
So blood vessels expand होते हैं,
नहीं,
सूजते हैं.
बंद- there is a blockage in your blood vessels,
Okay.
and the blood supply is hampered to the retina, and that will lead all the complications.
So it leads to blindness eventually.
Yes,
But I'm assuming there is a little bit of.
it's the last stage.
Okay. So rather than going to the end, we'll start from the
Yes,
beginning.
yes.
How do you diagnose this? Suppose you have a patient with diabetes. I'm assuming they have to get their checks done regularly. Is this every 6 months, every 3 months? What would you recommend?
That depends. If patient is present first time with us, so we just check the routine, all the parameters of our in our clinic. Once we diagnose patient has a diabetic retinopathy in any stage, then we suggest the patients that you have to check every 3 or 6 months according to your control of glucose.
So the level of your sugar, your your
Yes.
HB1AC will.
Yes, that is in our general, it's a glycemic control. Your glucose should be in control.
Okay. So anybody with diabetes can get this?
Yes.
So
Anyone.
is there a greater incidence in type 1 or type 2? ऐसा कुछ है?
Marlene, as you know, type 1 diabetes is mostly occurs in young patients, and type 2 is mostly in the old patients. And as we know, young patients are a bit healthy. So their vessels, their other structures, and their healing process is little bit faster. So they are affecting a bit late. But
Okay.
once they affect, then outcome will be same. And in older patients already there are many comorbid conditions. They are already old. They have less, slow healing process. So you get early changes in that patients.
Okay.
But ultimately, outcome in type 1 and type 2, once you get diabetic retinopathy, the outcome will be almost same.
So there is there a way to reverse this?
No.
Okay. So the best thing to do is prevent it.
Yes.
So for that again we're coming back to regular checkups. And okay, how do I even know that I might have this? Suppose if I have diabetes and I go to my regular GP. So if I go to a general physician, and so what are there certain symptoms of this?
Yes. Mainly those who are diabetic patients, they have a dimness of vision. There is many other factors which lead to dimness of vision, but one is the dimness of vision. They got floaters. Something black or anything appears in my field. They suggest, sir, when I saw on the sky or any background where it's white background, I feel there is in my eyes, some like insects or parasites like that. Vision will be tortuosity of vision. Vision will bit skin
Blurry?
is not, yes, blurry and bit complex like that. There is sudden loss of vision. These
But
are-
floaters though you can have without any other
but
complications
when
also.
you have a diabetes and you get floaters,
As a
then you
sudden
have,
onset.
then you have a
Okay.
those who are non-diabetic now, they are more concerned with floaters.
Okay. So I've come to you. We are suspecting retinopathy. How do you test for this?
First and foremost, we check the visual acuity. Then we check the.
Is that like a reading test?
Reading test.
Okay.
Intraocular pressures and anterior segment of the patients. Then we do some dilatation test and do fundoscopy. There's two types of fundoscopy, direct and indirect. We do both.
What is a fundoscopy? I'm sorry.
Fundoscopy, we just check the retina.
Uh-huh.
retina is the inner layer of eyes.
Yeah.
So we have to check.
So for light responsiveness, swelling, welling, like what exactly are we talking about here?
Once we check retina with fundoscopy, we see the condition of your vessels. Is there any edema? Is there any hemorrhages? Is there any healing hemorrhages? Is there any neuropathy? These all factors are responsible in diabetic retinopathy.
You said edema. Isn't edema
Edema is
usually
like a
a
swelling.
fat deposit or something?
No,
or
ma'am.
that's
Edema is a
that's something else.
fluid when your vessels are bit weak because of diabetes. The fluid or the blood pour outside. They do some swelling.
So you're
in your
saying
retina.
that they burst
Yes, they are leakage.
inside your eyes?
Yes.
That would affect vision, I assume, because it would get all.
Yes.
Ah. Okay, so we're talking about treatment options. You said that you can't get rid of it, but you could treat it.
Yes. Initial stage we treat with the first and foremost is control your sugar.
Of course.
Then we can treat with some medications like topical drops is there. Some oral medicines are there. If stages go further beyond, then we go for the laser procedures. We have intraocular injections are available for the same. In very late stage, we can go for vitrectomy or retina surgeries.
And what about new therapies, gene therapies, targeted kuch ho raha hai usme?
No.
Is there any research happening on that?
That is just for your control your diabetes. Not
Okay,
for
so not
retina
directly
surgery.
for this. All right. We are also looking at family support. I would assume that if I suddenly start losing my vision as a diabetic patient, in whatever age group, that would be very hard on not only the patient but also on their families, right?
Yes. Actually, once you get a disease, disease which is not not in a single sitting controllable, then family always suffer.
So is there anything the family can do to support the patient specifically?
Just do proper counseling, follow the medications, control his habits, and suggest him to take proper diet, exercise, and everything else.
That is before it.
Yes.
But once your vision gets, I'm assuming it would be very scary for somebody to suddenly start losing their vision.
The same thing he or she is supposed to do.
So it's the same thing. There's nothing.
Yes.
All right. Basically, I think I have exhausted most of the questions I had for you. Is there anything interesting that you would like to share about, say, patients who have come to you with this? Any interesting stories?
In my point of view, as an ophthalmologist, I just suggest each and every patient as an ophthalmologist, we are the only doctors who guide your physician, nephrologist, neurologist, and anyone else. What is the actual condition of your vessels in your body without any penetration or without any invasive procedures. Just do fundoscopy, OCT, and angiography.
That is so cool.
So I suggest each and every diabetic patient just go regular checkup for your eyes and that will be helpful to you as well as your doctors.
Okay. So I'm sorry, I just want to come back to the whole idea of when you're looking into somebody's eye, you're looking for broken blood vessels, you're looking for swelling,
Yes.
and you're looking for
Hemorrhages.
So basically leaks. Now, one would think that your eyeball is small and your retina is even smaller.
Okay.
So, but you've given us a lot to think about how much that little tiny organ is affected by diabetes. So if somebody is newly diagnosed with a retinopathy, is there any, apart from control your sugar, is there any other advice that you would like to give them?
And the same, control sugar is okay, but if you have any addictions, if you have a strong family history, if you have anything else, then you have to be careful.
Okay. And does this have anything to do with, you mentioned cholesterol, I think, right?
These are all
BP
comorbid
also.
conditions.
So how exactly does that work? Like, how does a little bit of the medicine behind it, if possible?
Hypertension, cholesterol, nephropathy, even anemia, pregnancy, everything can affect in your diabetes.
So does gestational diabetes have a particular role to play in this? Because you were discussing that earlier with Dr. Yogesh. So because that is a one-time thing, it may or may not come back.
Yes.
So how does that affect your chances of developing this later?
As we suggest, the type 1 patients have a there is a more range of healing and everything else. So they develop bit late diabetic retinopathy, and type 2 patients we mostly see in very fast, they develop within 5 years, as we study everything in a 5 years range. But after 10 years or within 10 years, we show the patients, those who have type 1 or type 2, ultimately type 1 patients are more with diabetic retinopathy than type 2.
Okay. So in a type 2 patient, how long do you think that if say the sugar is upar niche thoda, how long does it have to stay up at one go, or is it like an accumulated thing?
My point of view, those patients who already I shown and I studied the things, I just tell my patients that each and every patient has a different threshold. So controlled diabetes is not an important thing. The thing is, you just know what is the threshold level. What is your body permit to allow your sugar to control everything else. So you have to identify your threshold, and then you just enjoy your life.
No, my question was that sustained high levels of glucose. So suppose you have say 3 weeks of high glucose and then it goes back to normal, or does it have to be for longer periods, say 6 months or 1 year or whatever?
No, ma'am. That is depends. Actually, that is depends all your parameters. Ma'am. Sugar high. Suppose I have one patient who have a sugar 254. First time he diagnosed as a 254 sugar. He is quite enjoying his life and he is at 50 plus age. So he just told me, sir, भगवान ने दिया है ना, तो मैं इसको maintain करूँगा. I just saw him for more than 8 to 10 years with same sugar level, more than 200 or 250 plus. If any time his sugar is less than 150, he just go outside, take some sweets or ice creams and maintain it about 200. But I just saw after 8 to 10 years, there is no single changes of diabetic retinopathy in his eyes.
So it's literally a case to case.
Yes, that is threshold.
Okay.
That's why I'm telling it, that is all depends on your threshold. आपका body कितना bear करता है, वही आपका threshold है.
All right. Okay, so that's been very, very informative. Thank you so much for joining us. That was Dr. Jimit Sanghvi again. We are on the Wellness Benefit podcast and I'm Marilyn. Thank you for joining us. If you like this, share this with your friends. And if you didn't like it, tell us why. I'll see you next time.
Thank you.